Good afternoon, and welcome to today's virtual event, Bridging Gaps in Asthma Care, sponsored by Chiesi. I'm Jesse McQuarters, branded content editor here at STAT, and I'm thrilled to have you with us. Before we dive in, a quick note on housekeeping. At the bottom of your screen, you'll see several icons. You're welcome to use the chat to connect with one another or to reach out to the STAT team. For questions, though, please use the Q&A feature. That's where you can type in questions for our speakers, see what others are asking, and even upvote the ones you most want answered. We'll take those questions toward the end of today's program. Now let's set the stage. Today's conversation highlights new findings from a recent Asthma Community Survey sponsored by Chiesi and driven by a diverse group of clinicians and advocacy leaders from the Asthma and Allergy Foundation of America, Allergy and Asthma Network, Right to Breathe, and the American Lung Association. The survey collected responses from nearly 400 individuals living with asthma across the US, and it revealed a defining challenge in asthma care. Most people with asthma recognize that environmental triggers, things like air quality, allergens, or access to green spaces, really strongly affect their symptoms. In fact, 83% said that environmental triggers strongly impact their asthma. Yet only a small fraction, just 8% versus that 83, reported visiting green spaces daily. That striking gap underscores a larger disconnect. People understand the drivers of their condition, but too often lack the clarity, tools, or support to act on that knowledge. The findings point to a real opportunity, embedding environmental health literacy, which we'll define and talk about today, across the entire asthma care continuum, from clinical settings to community programs to digital resources. Giving people the knowledge and confidence to navigate their environments, improve indoor air, or even make simple daily choices could really lead to more responsive, patient-centered care and better long-term outcomes. We're fortunate to be joined by two leaders in the field to explore this challenge and outline potential solutions. Dr. Anju T. Peters is Professor of Medicine and Director of Clinical Research in the Division of Allergy and Immunology at Northwestern University, Feinberg School of Medicine. And also Cindy Trubinsky is Senior Director of Nationwide Health Promotions and Asthma Programs at the American Lung Association. It's an important conversation, and I am so excited to get started today. Dr. Peters and Cindy, welcome.
Thank you.
Thanks so much. Look, I'm glad to be here.
All right, wonderful. So Cindy, if you could start, just tell us, give us a broad overview. What did this 2024 Asthma Community Survey reveal, and what did it really tell us about the daily lived experience of people with asthma?
Sure. So hi there, everybody, and thanks so much for the opportunity to discuss this very important topic and the survey results. So as always, it's important to start at the beginning. Avoiding and removing asthma triggers from indoor, outdoor, and occupational spaces is a key step to preventing symptoms. And by removing asthma triggers, air quality can be improved while reducing symptoms in children and adults. So additionally, this step has been proven to decrease hospitalization, emergency department visits, and the use of quick relief or rescue medicine. So first, let's also define health literacy in general, which is a vital skill to manage overall health and how it impacts asthma specifically. Health literacy is the ability to do three things: to understand, to interpret, and then to act upon the information to protect your health. And then environmental health literacy, what we're talking about today, specifically focuses on environmental factors that impact your health. Improved environmental health literacy has been identified as a way to improve those outcomes and quality of life for people specifically living with asthma. And for asthma, this is also an important part of the best practices in the U.S. asthma clinical guidelines for optimal care. The four components of asthma care include the assessment of severity and control, the education for partnership and care, which includes the self-management education and asthma action plans, the use of medications, which is the stepwise approach and the proper use and technique of those medicines. And then the fourth is controlling environmental factors and comorbid conditions. This is the component indicated by our topic of discussion today and segues us into that human impact of environmental triggers and then our potential solutions.
All right, Cindy. Yeah, that's a really wide-ranging look at the impact of the survey, some of the things covered. If you just had to like summarize it in one kind of takeaway message, in one real compelling reason why the survey was conducted, what is that?
We really wanted to look at what the patients are looking for and how they interpret and then act upon their needs for health.
All right. Well, wonderful. Well, I definitely want to hear what happens in the clinical perspective. We're really looking at two sides of the same coin, right? Kind of the lived experience of people with asthma in their daily lives, and then how doctors in the medical community can best support them in their care. Dr. Peters, how do you see this play out in clinical settings, and what are some of the gaps that you encounter in patient understanding of environmental triggers like air quality index or pollen?
Yeah, so I think this is really important. Just like Cindy said, we do have asthma guidelines. It's important to note, asthma is one of the most common chronic conditions in the US. 28 million people in US have asthma. Many of them are allergic. I'm an allergist. And we think of asthma as a chronic condition. People live with it, but we also know people die from it. On average, 9 people in US die from asthma each day. And sadly, I'm an adult allergist. Adults are more likely to die from asthma than children. And one of the things we saw in disparities were women were less likely to make changes. They were less likely to follow this environmental health literacy. And female adults are more likely to die from asthma than male adults. And just as you mentioned, many people, more than 80% said that environmental conditions have a strong impact on their asthma. So we know it's really important. But the way it plays out in clinical settings is, even though people are aware, they're not comfortable following the guidelines, even though the guidelines say, here are your environmental triggers. But one of the things that I realized, and I think the gap is because we as clinicians don't have the time, don't have the resources, don't have the support system to tell our patients about environmental health literacy. In addition, I feel like many of us who are clinicians are ourselves not as well informed. We don't know how easy it is to look up the pollen count. I often tell my patients that I put that in their discharge notes. And those are some of the things we can do. But I think the bigger thing is that unfortunately, many of us even clinicians are not aware. We lack the time, we lack the tools or training to understand all these air quality indices, humidity warnings, etc. EHL is just not embedded in our everyday care. We really need system level strategies to make the information clear, not just for clinicians, for our patients as well, so we can help our patients understand the risks so they trust these resources and they make these changes. I hope that answers the question.
Yeah, absolutely, absolutely. So, we're talking a lot about environmental health literacy here. Can you tell me a little bit, is that a defined term in terms of, something that's universal amongst clinicians, that they all really understand what that means? And, why is it not really a clinical standard at this point?
So I don't think actually environmental health literacy is a term that most clinicians understand. So I think one of our main jobs is to make it so that clinicians understand this, because unless clinicians understand this, we're not going to share this with our patients. So I do think we should inform our clinicians, also share with them the resources. Cindy's going to tell us about some of the resources. I was not aware of many of these till I was part of this great program. So I think informing our clinicians, educating is a big part. Guidelines can do this, but guidelines need to be very clear with this. And then again, once we do understand this, I think we need to be able to have resources and time to share these with our patients. Like you said, and most people are aware that environmental triggers can impact their asthma. And sadly, if we don't tell our patients where to look up the pollen counts, where to look up the air quality indices, then we're not doing our job. So time and resources, I think, and educating the clinicians is a big part of it.
Absolutely. And what you're talking about are, individual reach outs and the clinicians taking individual action. Are there bigger structural barriers that we could be working on to kind of integrate some of this awareness and some of the information into, clinical care routines and communications?
Yeah, I think it starts out at an individual level, but there's definitely bigger ways that this can be changed. I think the federal government, the EPA plays a big role in air quality indices. I think we could put this out in social media for those people who are in social media. I do think, one of the biggest things I took away from this survey was that people, even on good air quality days, they will avoid green spaces. One of the things I tell all my asthmatics, if you can exercise is really good for your cardiopulmonary health. It's so surprising. If someone's asthma is well controlled, they should go out and exercise outside, especially in an area like Chicago where we only have such a short summer. I don't want my patients staying indoors other than some rare days when it's really poor air quality. But this way, patients should be comfortable themselves checking air quality and going out there if their asthma is controlled. So I do think federal government and EPA can play a role. Our national societies can play a role. Our guidelines are there, but I think our guidelines can do more. And at our national meetings, like, for example, American Academy of Allergy, Asthma, and Immunology, we are involved in asthma care. We can play a role. There are great groups, like Cindy will talk about American Lung Association, different ways to get this message out to people, whether it be on TV, whether it be on apps, whether it be on social media, but with as much personalized care as possible. So what I wish I had an app that would go out from my clinic saying, hey, this is a good air quality day. If you can, go out there and exercise. It's good for your lung and your hearts.
Absolutely. Yeah, I'm in Chicago as well, and certainly almost considered doing this webinar from outside. It's so beautiful. So yeah, I think that's so important, and definitely, for the health of patients and really doing well. Really important points. Cindy, I wanted to talk a little bit about some of those disparities that we talked about. It's really important to really include all of the patient populations out there. How can we build confidence? How can we really figure out who needs to be reached the most, and how do we really create change in these underserved populations? Like, what does it look like?
Sure, that's a great point, and I'm going to circle back just for 1 minute because I think what Dr. Peters mentioned would really put a point onto some of the things that we learned from this survey. And there's 5 key takeaways that really resonate and drive our discussion today. And I want to share those with everybody. So first of all, we've kind of heard already that people with asthma are aware that triggers are important, but they need a little push. They need to be empowered. And then some statistics that 83% of them really have that impact around triggers on their asthma. So environmental health literacy is overlooked, and we need to do more. That's obvious from the conversation. Women are reported having lower confidence in doing that and making that action, that knowledge into action. And then disparities do exist and persist with indoors and outdoor air quality. So both of them are very important. And then integrating this into everything that we do really is an equity solution. So it's very imperative. So when you're talking about disparities, I'm going to jump right in there. Asthma disparities are well known. They come in marginalized and underserved or underrepresented populations, including Black and Brown communities. They're geographic. By the location that you live in, whether it's air pollution or urban and rural areas. And then there's also the lack of asthma self-management education offered in a consistent and standardized way that includes environmental triggers. So in order to address these disparities, health equity for all should be the main goal. So ensuring people that they have a fair chance to achieve their optimal health status. And part of health status is 30% of it can be attributed to health behaviors. And then 20% of it can be contributed to our actual health care itself. But that leaves a huge window of opportunity for improvement through what we call social determinants of health. These are those non-medical conditions that impact, influence health outcomes, including asthma, to which people are born and grow and work and live and age, and the systems or communities and geography that shape everyday life. So example domains of this from the CDC Healthy People 2030 include our economic stability, our education access and quality, our social and community contexts like green spaces, healthcare quality and the access to it. Are there providers close to me? Building environments such as age and the condition of housing, or are the green spaces available to me, or are they safe for me to go to? And then, as I mentioned, geography, the urban, suburban, rural sets that have unique conditions. So by continuing these guidelines-based care and addressing environmental concerns through health literacy and social determinants of health, we can really make an impact on health and those disparities that exist.
Absolutely. And Dr. Peters, before we move on, I just want to ask you, because this is such an important point and so critical, anything from the clinical perspective that you wanted to add to what Cindy said about what's possible?
What Cindy said was so important. Like one thing, Cindy, you said, make green space available to all, make them safe so we are not afraid to be out there. In city Chicago, by 4:30, it's dark in the winter. Some things that we all can do, asthma action plans are used all the time. We should put EHL into our electronic medical records. We should train our staff to teach our patients about it. Make it everyday part of it and bring it up at each visit. We see patients back 3 to 6 months. We should ask about this. We often ask about indoor air quality and mold exposure, smoking exposure. We don't often encourage outdoor stuff as much, but we should. And I totally agree with you, Cindy. Disparities exist. We need to do a better job using many of the resources that many people use, social media, right?
Absolutely. Absolutely. So yeah, we've talked about a lot of what's missing. We've talked a lot about what's possible. Certainly a long patient journey that in a lot of different things that affect patients' health. If you could both just, give me one change, that each of you would prioritize tomorrow in that range of options to bridge this asthma care gap, what would you choose? Dr. Peters, I'll start with you.
I'll tell you what I've already chosen as I got to see the findings of the survey. Like I said, we lack the education. So what I'm doing is I'm educating my patients, I'm educating my fellows in training, I'm educating anyone who's listening to me about EHL. And really our goal of asthma is, if we all work together, clinicians, support programs like Cindy's involved in, our patients, working together to realize that the goal of asthma is to make sure people don't have symptoms, best asthma control possible, decrease exacerbations, improve sleep, improve activity, improve quality of life, decrease morbidity and mortality. And EHL can play a big part in this because a lot of this is modifiable.
All right, excellent. And Cindy, I would imagine you'd say, many of the same things and certainly agree with Dr. Peters.
Yes. So immediately, like if you want to do something today or tomorrow that everybody can accomplish and this audience today can do, there's actually 3 things that are all linked and they're super easy to do. So one is learn more about asthma and environmental health conditions and health literacy specifically, how to best provide this information to your network of patients. And a good starting point is many of the resources that we're going to talk about. lung.org/air is a great starting point. And then I want you to test it out. So make a commitment to try it out with 5 patients this week and really expand the discussion on environmental health and social determinants of health as a simple test on how easily it can be done. And then get involved. So by joining the resources that we have, and American Lung Association has a Health Professionals for Clean Air and Climate Action newsletter to become more informed on high priority topics, and then how you can become an advocate for change that benefits asthma and all patients. So 3 things all in one.
All right, excellent. And we do have a question from the audience. I'm going to try and do my best to get this right. But they say that, some like asthma is kind of interesting in the way that it presents. Is not necessarily outward presenting. Can you talk a little bit about reasonable accommodations at work due to asthma? Are those common? And just do you have any advice on kind of navigating that situation a little bit? And Cindy, I'll start with you.
Okay. Yes. So I mentioned indoor, outdoor, and occupational settings for doing that. And I think this is reflecting on that component. And really, where you work is a good portion of how you spend your day, and the air that you breathe is very important. So lung disease can be caused by occupational exposure, but even if you don't have that, you have a lung disease that can impact through triggers and or irritants. That is a very important piece that needs to be advocated by yourself with your employer. So accommodations can be made on a real basis from everything that's identified, but it's very personalized. So it can be put together with a plan with that employer on how to address it. And it's very important to have that conversation. So activating people, we have checklists and materials that can help guide you through that conversation with your employer.
Absolutely. And Dr. Peters?
I agree with Cindy. It has to be very personalized, and finding out what are triggers for that patient, for that person. And then we work together with patients. If you have a clear occupational asthma, avoidance is number 1. But there are many things that can affect someone. It could be mold, it could be dust mite and carpeting in your work. There are many things. People now bring in pets. And if you're working next to someone who brings in a pet to their work, maybe you need to be separated. There are many different things that we need to personalize. Education is key.
All right, good point. And that kind of brings me to my closing question. What are some of the additional resources that our audience can take advantage of and read and kind of dive into? I know there's been a wealth, including the community survey that is kind of the impetus for our conversation. But certainly in the lead up, we've talked, we've kind of looked through so much just in our lead up to this conversation. Dr. Peters, I'll start with you, and just what are some resources?
Yeah, for me as a clinician, my guidelines are great resources. The GINA asthma guidelines, which are worldwide guidelines, the NHLBI guidelines, we have practice parameters. But I will tell you what I learned, and I think these are great resources, which Cindy can tell us, looking up, Allergy and Asthma Foundation of America or American Lung Association. As I mentioned earlier, I now have that website in my electronic medical records that I am now giving to my patients with asthma as part of their asthma action plan. So Cindy, take it away.
Okay. So accomplishing this is really important. There's 3 things, and then we can translate into the resources that we're going to connect people with. So standardized asthma self-management education, making sure that everybody gets that high level of service around how to take care of your asthma. And that everybody, as we mentioned, needs an asthma action plan as a guide to help them move forward on their environmental factors. And then empowerment between the healthcare professional working together with the patient in a shared decision-making model. And so in order to do that, you need the resources that go along with that. So this group was a diverse group of nonprofit organizations and patient advocacy groups. We put together a list that is, I think, a fantastic list. We have things like our airnow.gov, which is the resource that goes around air quality on a daily basis. You can see localized information that's helpful on a regular basis. We have programs that are clean air at home and lung health navigators that can help teach you about your needs and then the resources locally. Things like how to clean your own air cleaner. Very simple and very helpful and impactful. There is the Asthma and Allergy Foundation of America's pollen and weather reports. There are alerts that go with that. And then they also have an asthma capitals report, which just came out this week, that really showcases where you are in a report form of where you live. The State of the Air report is something the American Lung Association does that can also fine-tune that air pollution in your neck of the woods by grading the areas. And we do that on an annual basis. The Centers for Disease Control and the Environmental Protection Agency and they have resources on how to look at things that are in your indoor and outdoor environment. The guidelines, as mentioned, programs like the Trusted Messenger program, and then things like 211 are national services that bring something right down to your community level and connections. These are all community linkages that help take the clinical into the community and then also support it in that digital format.
Absolutely. And super important is this, survey coming up, the Asthma Community Survey will be a critical piece to add to the literature and resources that will be published as an insights report and infographic ahead of the CHEST conference. There will be a Stat Brand Studio custom article that will detail some of those findings and kind of boil those survey results down. So lots more to come for sure. I did want to thank Anju and Cindy. Thank you both so much for taking the time to talk today and share some of your knowledge and insights about environmental health literacy, asthma care, and all the things that we could do.
Thank you.
Thank you. It was a pleasure to be here.
Amazing. I also want to remind people that the STAT Summit, our flagship conference event, takes place October 15th through 16th in Boston and online, marking STAT's 10th anniversary this year. It definitely brings together the biggest names in science, medicine, and policy to explore what's next in health and life sciences. Definitely hope to see you there. I'm Jesse McQuarters, editor of Stat Brand Studio, and thank you so much for joining the conversation today.